Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. I was off last week, but I'm back again with you today. So hopefully we have a good, there's a lot of people that show up, and hopefully y'all get some good help here tonight too. The way these webinars work is you create them with your questions, and how you send questions to me and to the whole group is to actually write them in the chat box. When you write them in the chat box, make sure that you send them to everyone. So don't send them to me directly, but to the whole group, okay? And the way that this works then is I will read that question out loud, but also because it's in the chat box, you all get a chance to read along with it at the same time too. As I take these questions, after I answer a question, or as I'm answering a question, I may ask the person that wrote that question for some more details to help me answer it. And then once I do give an answer, I will open it up for further discussion about that topic. Nothing, not about everything in the world, but just about that topic. So you can ask other questions about that topic and that response that I just gave. So the reason I'm trying to emphasize just that topic is sometimes people get confused and they try to ask a whole new question. And the whole new questions have to be answered or asked in the chat box. Okay, that's how I take them. And then I'll try to get through as many of these as I can tonight. Usually we're not able to get through everything, but hopefully you'll still get some good information, even if I don't get directly to your question as well, too. Okay. And then, as usual, I am creating a recording of tonight's event. And sometime tomorrow morning, depending on how everything works out, I should get that out to you somewhere around 9 to 9:30 a.m., sometimes a little bit later, but somewhere around that time. I send out an email announcing that the video is done. And if you're unable to find that email, let me show you where you can go and see the video. I'm going to do a quick screen share here for you real quick. All right, so many of you may know that I redesigned Marty Ross MD supplements, and it has launched a few weeks ago. Been a little bit of a difficult launch. We had a lot of technical problems that I think for the most part have gotten worked out. And that was large part helped by moving to a new server yesterday. So it's a lot faster site now. And I'm sure we're still going to have some glitches. Like I understand today that some of our confirmation emails are not going out, but that'll even be fixed tomorrow. But anyhow, the site's going pretty good now. So where you can find information about the webinars is right here. You click on the webinars. And this is where you can both sign up for the next webinar, okay? And then the other thing you can do is you can actually see the most recent recording right here. I post it up, they'll show right here. So if you happen to miss the email, this is where you can come and watch it. The other thing you can do is if you don't want to click this, you can actually view my whole my whole playlist from years of doing these on YouTube. And on YouTube, when you watch it there, there's actually a timestamp that you can use to find the different sections that you want to see. Okay, so anyhow, that's how you find information there. Okay, all right, let's go back here. All right, so let's go ahead and take our first question here tonight. So first question is from Colleen. Hi, Colleen. I haven't seen you, or I haven't had a question from you in a while, so I'm glad to see you're still here. Let's see. Well, I'm sorry to see you're still here. That means you still need help. But anyhow, I'm glad to help you. Let's see. A few months ago, I finally began doing your full protocol for mitochondrial repair. Yahoo! I'm getting my annual blood work done soon and need to decide how many days in advance of the blood work to pause certain supplements I've been taking to get accurate test results. So this would be Trifortify, ATP 360. So you list them all out. Everyone, you can read those if you want to. And then the blood work is going to be glutathione, ferritin, iron, iron, TBIBC, a complete blood count, a comprehensive metabolic profile, vitamin D, vitamin B12, thyroid testing, and hemoglobin A1C, G6PD. All right. So in general, I think if you stop all of your supplements about 2 days beforehand, I think any effect that they might have on these blood tests will probably go away. In fact, probably if you just were fasting overnight, meaning you stopped all these the day before, you'd be fine. But if you want to be absolutely safe, you may want to take a couple-day break from that. Okay? All right. So Colleen, are you still here? Did that answer your question for you?
Yes, I'm here. Thank you. So that includes the ferritin, iron, and all that stuff.
Right. I think a couple days should be fine on all that.
Okay, that sounds great. That makes it a lot easier.
All right. Good luck to you.
Thank you.
All right. So, for those of you that aren't aware, there is a whole protocol I have, an article I have about how do you fire up your mitochondria. Your mitochondria are your energy factories found in every your cells. And when you have chronic illnesses like Lyme disease due to oxidative damage, too many oxidation agents made by your immune system, you can get injury to the covering of your mitochondria and they don't make enough energy. Okay. So for those of you that want to know a little bit more about that, I'll just do a quick screen share here and show you the article that I have on that. And so what you would do is you could look under my Lymology guides here and you see the whole mega menu that shows up. You can click on that energy and fatigue, and here is the article about how to power up your mighty mitochondria. Okay, that gives you the key tools and information about how to go ahead and fix your mitochondria. All right. All right. So let's go on here. So does anyone have any more questions about Colleen's question there, or any follow up there? All right, let's move on then. Let's see, Jim. Let's see. My wife is diagnosed with ALS, but also has Lyme Babesia, Taconi Bartonella toxicity. The ALS began after a bad bout of COVID a year ago. Regarding mold, she recently had a repeat test from real-time labs, and her ochratoxin A levels increased significantly since starting the binder regimen. Now 42 parts per billion, as opposed to 1.77 in January. Would you treat mold before treating Lyme Babesia and Bartonella? She is currently taking or currently treating Bartonella with rifampin, azithromycin etokinase. What are your thoughts on IV phosphatidyl choline? Do you ever use this or consider it when practicing? Best regards, Jim. So, so a couple thoughts, Jim, and I may have to ask you a clarifying question, but I'll make the comment here first. Sometimes, when you start to detox your mold toxins, as you start removing them from the body, the kidneys develop a better ability to pee them out. So removing some of those toxins. Oops, somebody's got their mic. Hold on a minute. I gotta mute somebody here. There we go. Okay. So if you so the way that the test is done is you're trying to see how much you can pee out, which then gives us an indication of what may be stuck inside of you, okay? And when you are really loaded with toxins and very sick, sometimes the body's ability to remove those toxins gets worse. And as you start pulling toxins out and you start treating your Bartonella, for instance, the body is better able to pee the toxins out. And so therefore, sometimes when you, especially the first time you go ahead and repeat your mold toxicity test, it can look worse, but it may not mean that there are more building up in you. It just may mean you have a better ability to pee them out. Okay. And so sometimes what we'll wind up doing when I look at those follow-up mold toxicity tests, I also want to, know what's happening with the person. Is there any way that they're looking better? Anyway, it can even be small improvements. And if there are some small improvements and yet you see a worsening on the mold toxicity test, that may just mean that they actually are doing better. They're better able to pee them out than what they were able to do before. Okay. So, Jim, is she doing any better in any way at all?
Her decline has slowed down.
Okay.
So in that regard, better.
Yeah. And that may just be a sign of it. And usually, what I would do then is probably repeat the urine mycotoxin test in about 4 to 6 months again. And if that time you're not seeing improvement, then there's two things you need to be concerned about. One is there still in your environment, her environment, is she still being exposed to mold toxins? Okay. And that's a hard one because it can be really hard to find them sometimes, even with a good inspector coming out. Okay. The other thing that we wonder sometimes after a second repeat and you're getting worse, we have to start wondering about, is a person colonized? And what that means is a small percentage of people that live in moldy environments, the mold releases spores. Those spores can sometimes cohabitate in our nose passages, sometimes down in our intestines, and then they start producing toxins. So if I go ahead, and there's not a good test we can do, like if you do a swab and see if there's mold spores, well, we probably all have some mold spores because it's how they get filtered out basically. That doesn't tell us whether they're producing the toxins. So, okay, so we don't have a good test that we could do to say in your nose are mold spores that are producing toxins. But on a second repeat mold toxicity test, if your test is getting worse, then I might, in addition to wanting to be definitely sure to have inspected the environment, I might add in an antifungal agent that can start killing mold spores. And what I like using for that is itraconazole. And itraconazole, to be honest with you, is an agent that can help with her Bartonella as well too. You could probably pull out the rifampin and put the itraconazole in. And it through the bloodstream, it gets at the nose passages, and also it can get at any mold toxin or mold spores that are built up in the intestines. The other thing I like to do is some type of a nose spray, whether it's a nystatin nose spray, an itraconazole nose spray, an amphotericin nose spray, to get up here in the nose passages as well. But again, I'm talking down the road for you for something to consider if that test gets worse again another time. Okay. And then in terms of phosphatidylcholine, so as we were just talking about with Colleen, Colleen is doing a program to repair her mitochondria. Mitochondria and your cell membranes, your nerve cell membranes, any cell membrane, the covering of mitochondria and the covering of your nerve cells, especially in your wife's situation, one of the key fats that makes up the coverings is phosphatidylcholine. There's also some other fats. There's phosphatidylserine, but there's choline and serine are the big ones. There's some other more minor players. And so when I'm trying to repair mitochondria, I usually work with this product called ATP 360 that has phosphatidylcholine, phosphatidylserine. It's got a bunch of other phosphatidyls in it, okay? Or you can give IV phosphatidylcholine. And what the idea is that those phosphatidyl fats, those phospholipid fats, will replenish the fats that make up your nerve cell membranes and even the mitochondria membranes. And so there is, for instance, there's a protocol out there called the PK protocol, designed to rebuild, which is basically made up of all phosphatidylcholine. Okay. But I prefer actually doing the oral, which is that ATP 360 product, but it's the same idea. You're trying to replenish and replace the damaged fats that make up your nerve membranes and even the mitochondria membranes, and you can get repair and healing that way as well too. So I think it could be a good idea for her, especially with the neurologic injury that she's got with the ALS. I think that could be a good idea for her. Okay. Any follow-up question there, Jim?
The ochratoxin A, in your experience, is that number of 42 parts per billion, is that really high? And is that something that could be neurologic?
It could be neurologic. Especially with somebody with ALS, I want to track down anything that could be causing neurologic injury. And so, yeah, that would be something I would go after.
And regarding the ATP 360, I didn't realize that product had phosphatidylcholine in it.
Yeah.
Do you think the absorption would be comparable to what you'd get in the IV?
You're going to get more in the IV, but the only problem I have with phosphatidylcholine is it's only repairing one type of fat that makes up your nerve cells and your mitochondria membrane. I think the ATP 360 is more comprehensive, actually. And Research Nutritionals has done a limited study. I think it was around 20 people or less, but they've got the study showed significant improvement in oxidation levels of the fat membrane, so decreased oxidation. Okay. It also showed marked improvements in thinking. I think it was like around 50%, and marked improvements in energy as well too using their product. And granted, it was a small study, but they've got some evidence showing effectiveness. And actually, part of their study showed better immune function, and presumably better immune function because of mitochondria is working better in your immune cells, and then therefore they work better as well too. Yeah.
That's great. Thank you. Appreciate it very much.
Okay. Yeah, you're welcome. Let me just show you something here, just so everyone we can look at this together here. Um, okay, so in terms of the ATP 360, oops, that's it right there. And basically, So we get that up. So they have this thing called RN lipid concentrate. Okay, so it's got phosphatidyl choline, phosphatidyl ethanolamine, phytoglucolipids, and phosphatidyl inositol. Okay, and so this is a pretty broad compound basically, and I think it's a little bit more thorough in terms of its ability to repair than what a phosphatidyl choline would be. The other thing that I like about this product in terms of mitochondria injury is it's got a bunch of micronutrients, including this CoQ10, some NADH in here. But then the other thing that's interesting is this compound here called PQQ, pyroquinoline quinone, and I can barely say this one sometimes. PQQ, I'll just say it that way, actually promotes mitochondria biogenesis, which means it helps lead to the production by the body of more mitochondria and actually increases the size of existing mitochondria too. So you get better energy generation out of it too. So it's a nice complex, especially you can assume with anything that's neurologic injury, there's probably mitochondria impairment. And so it's really useful. You could repair mitochondria at the same time that you're repairing some of the nerve cell membranes by using this compound. Okay. All right. All right. All right. Does anyone have any further follow-up questions to what Jim was asking or what Jim and I were just talking about?
I do.
Yeah, Jill.
Would you recommend taking that product the same time as your antimicrobial protocol?
Yeah, you
The
definitely
same
could.
time?
You definitely could.
Okay.
In fact, in my practice, often when it comes to doing, I kind of staged things when I was in practice. I always thought some of the most important things to do initially were, if you look at my Ross support protocol, you'll see I emphasize getting sleep, lowering cytokines by using some curcumin, supporting your adrenals with ashwagandha, and getting your yeast out. And those are some of the frontline things that I would do. Okay. And the Ross protocol is full of the frontline things you would do. But then at about 6 to 9 months, if I had a person that just getting germs under better control and lowering cytokines that way and getting them on ashwagandha did not greatly improve their energy, by around 6 to 9 months, I would start adding in mitochondrial support. And the two, you can read the whole article that I showed earlier, but the two big things you want to do for mitochondrial support are the ATP 360. You want to repair the mitochondrial membranes, you want to give nutrients, and you want to do that PQQ that causes more mitochondria to be made. Okay. And that's 3 pills 1 time a day. And then I also like to add in glutathione, liposomal glutathione. And Research Nutritionals has a product that is liposomal glutathione that I really like. It's the Trifortify product. And they've done studies on that one showing really good absorption compared to other products. You don't know what you're getting with other products. That one has good absorption. And what that does is that glutathione you can kind of think of as the reparative agent from the inside. So your ATP 360 is fixing membranes from the outside. The glutathione is on the inside of your mitochondria and inside cells repairing damage that way too. Glutathione is the restorative antioxidant made in every one of our cells, but if cells are injured, they sometimes can exhaust their glutathione supply. And so I like adding that in at about 6 to 9 months as part of my mitochondria repair protocol. Those would be the two essential things I would look at as liposomal glutathione and some type of a phospholipid mix like that is in the ATP 360. Okay.
Mhm.
Yeah.
Okay, thanks so much.
Yeah. Good luck to you, Joe. Did
Thanks.
anyone else have a follow-up on that? All right, let's move on here. Jim, good luck with your wife. Yeah. All right. Hello, Alexandra. Let's see. Hi, Dr. Ross. Thanks for all the information. I have a question on testing. My Igenix immunoblot was positive for Babesia microti and Bartonella. My doctors suspect that Babesia is driving the worst of my symptoms. If I were to have any additional direct testing done to confirm the diagnosis, which lab, companies, and specific tests would you recommend, knowing we are most concerned with Babesia? The Igenix fish and or PCR labs. Thank you, Alexandria Rossetti. All right, so there's in terms of so I understand you had the Babesia microti. Okay, I hear that. And there, in terms of the immunoblot, that is a very effective test at finding the Babesia microti. It is, and then they also have the ability to test for Babesia species, and they have the ability to test for Babesia decani. All right. Now, if your test on the immunoblot, so the immunoblot is the IGeneX method that looks to see, do you have antibodies? Is your immune system making antibodies against these specific germs? Okay. And if you have antibodies against Babesia microti, it's probably in you, and especially if you have a lot of symptoms of it. All right. In terms of if you have antibodies against decani, we now are beginning to wonder if antibodies against decani might be antibodies that were made actually against Babesia odecoilei, which is this newer strain of Babesia we're worried about. All right. But also, if your Babesia species test had been positive, there's a good chance that's due to Babesia odecoilei. All right. So on a good note, you don't seem to have anything that says possibly Babesia odecoilei, at least by the immunoblot test. Okay. Now, regarding the Babesia species, we think the most common ones are microti and decani. There's starting to be some growing discussion about, though, whether many people may have this thing called Babesia odecoilei, because if we look at Babesia species found in deer populations, especially in the upper Midwest, up into Canada, there seems to be a lot of odecoilei. There is also starting to be enough ability to differentiate Babesia species, and we're starting to see that maybe it's in humans, although we're not, it is in humans. We're not as clear about how many humans have it. Okay. Now, Babesia microti generally is fairly easy to get rid of. Babesia odecoilei, if you were to have that, can be very difficult to get rid of. And there are some doctors out there that are now thinking that maybe one of the reasons people with chronic Lyme are remaining ill might be that people have this Babesia odecoilei as one of their co-infections. And because we just don't have the best ways to check for it, that might be what's happening with a lot of people. Okay. All right. So that's a lot of stuff to say. All right. So then when it comes to Babesia odecoilei, the lab that has the test to figure out if you might have it is a lab that does a direct testing method, meaning they can see it under the microscope. You can see it. That's a direct test. Versus an antibody test means you have an immune reaction against a germ. So that's an indirect test, right? It doesn't really say it's in you. It just says you got an immune reaction. But T-Labs has the Babesia odecoilei test. And so if you've got a lot of Babesia symptoms and you're trying to see if it's possible you might have odecoilei as a cause of that, I would look at doing a T-Lab odecoilei test. I think they probably have the better test out there for that right now. I do want to let you know, though, something about direct testing. So direct test, again, is something you can see the germs. So that would be a fish test, like IGeneX has a Babesia fish test, and their Babesia fish test is for the species, meaning when they see it, it could be, if your Babesia fish is positive, it could be microti, it could be decani, it could be odecoilei. Okay, all right. Another way to do a direct test is to see, do you have the genetic material of that germ in you? And that's the PCR test. And then T-Labs has this method where they're looking under a microscope after they've attached a marker onto the germ that attaches to the genetics, and they look to see if they can see it. That's a direct test too. The problem with direct test is that it's only good if the germ was swimming by where you drew the blood at the time you drew the blood, right? And with all of these direct tests, we do not know how sensitive they are at finding a germ that's in you. In other words, we don't know their true ability to detect a germ when it's in you. So are they only good at finding it 50% of the time, or are they good at finding it 90% of the time? We honestly don't know. The testing has not been done. So when a test comes back negative, it doesn't exclude, when you're doing a direct test and it comes back negative, it doesn't exclude having the infection. The only meaning you get out of a direct test is if it comes back positive, it says, yeah, you got it in you. Okay. All right. All right. Now, When it comes to Babesia, many of us, even though we've got, the better testing now with T labs and some of the other labs out there doing it, even IGeneX Immunoblot really transformed our ability to find Babesia. But ultimately, with some of these co-infections, you just got to look and see, do you have a lot of symptoms that suggest that co-infection? And even if testing is negative, you treat for it. Okay. So, and it's just because we don't have perfect testing. All right. So things that make me wonder about Babesia are things like night sweats, air hunger, marked fatigue of the three Bs, the three big Bs, Borrelia, Bartonella, Babesia. Your most fatiguing is probably going to be Babesia. Okay. Air hunger. Now, air hunger is something you can see in Bartonella too, but that feeling you just can't get enough air from time to time. Headaches, especially a lot of frontal headaches, migraines can be part of Babesia. And then finally, sometimes people with an interesting symptom people with Babesia get is they can have a marked a lot of deja vu symptoms or feelings of deja vu. Not everyone does, but what's interesting when the deja vu is there, it's a really good symptom to follow to see if they're getting better, because usually it's one of the leading things that will go away as you start getting their Babesia under control. Okay. So that's a lot of stuff I just said. Do you have any follow-up question on that?
No, thank you, Dr. Ross. That's really helpful. So T labs, it sounds like is maybe an option if I wanted to confirm that
Right.
other strain of Babesia.
Right.
And then for Bartonella, what are your thoughts on a Galaxy? I know you mentioned like
Yeah.
you take a blood draw, you only get one shot at it, right? But a
Right.
Galaxy told me when I reached out to them that they actually do this three-time blood draw.
Yeah. So Galaxy for Bartonella does a PCR. They're looking for the genetic material, and PCR is how we amplify the genetic material so we can see it. And so they Galaxy acknowledges that that random blood draw may miss it, and so they try to get around the issue by having you do three separate blood draws to increase the chances of collecting a sample. The trouble is they have never done sensitivity studies to tell us how often do they find it when it's there. We really don't know. Because of that, my preference still is the immunoblot method, which is indirect for Bartonella. And IGeneX and some of its validation studies where they went and said, how good is our test at finding known samples of an illness? They're running, I think their sensitivity is like 93, 94% at finding Bartonella when it's there. So that's where I'd like to start with my Bartonella testing. If I'm going to do Bartonella testing, is I prefer to do the immunoblot because it has a fairly good sensitivity rate, meaning the ability to find it if it's there. And if it's negative, and I'm still questioning, does somebody have Bartonella? Don't they? Like if their symptoms scream Bartonella at me, I'm going to treat even with the negative test. Okay. But if I'm still wondering, I'm not so sure. And if the immunoblot's negative, then I might go and do the PCR Galaxy Lab methodology, basically.
Thank you.
You're welcome. Good luck. Does anyone have any follow-up questions to that?
Yeah, Dr. Ross,
Yeah.
is John Isnard.
Yeah. Hi, John.
Nice to finally have a chance to speak to you.
Good.
I over the last 6 months have had the TBD11 panel done by IGeneX, the Tick-borne full panel, and I could swear that it specified odecoilei with my Babesia positive reading. Did I misread that? Because it looked like they broke out odecoilei as a specific
I'm not aware
Babesia strain.
Yeah, I'm not aware they were doing that. Go back and look and see if they are. I was not aware that they were actually doing that. Does anyone know if they're starting to do that at all? Yeah, John, I don't know.
This was very recently.
I hadn't seen that they were doing that. I have to go back and see if they are breaking that out now or not.
Yeah, I thought I had the test with me. I was just trying to confirm it now, but it's at the house, so I'll let you know.
I know that the last time that I was at a the last time I was at a presentation where IGeneX was presenting, that would have been, I think, November of last year. That's at the annual ILADS meeting. I know that there was some talk about they were interested. I believe there was some talk that they were interested in seeing if they could break out odecoilei, but at that time they were not able to. So maybe they have done it. I'm just not aware of that.
Would you recommend treating, if it is odecoilei, treat that before the BART, or treat the BART before the
Yeah.
odecoilei?
It's a tough one because here's my observation, and this is also an observation of one of my teachers, Dr. Burrascano. I don't know if any of you know that name anymore, but Burrascano is a Lyme
He's
literate
famous.
doctor
Yeah.
from New York State that was kind of a pioneer in the whole field. And he still does a lot of education, but he's no longer treating. But his observation was that in patients that had Borrelia, Babesia, and Bartonella, his preference was to go after Borrelia and Bartonella first. And then after you started getting some of that Bartonella in control, then come in and do Babesia. You could treat all three germs at the same time. Okay. The reason that was his preference was based on an observation that if he tried to go after Babesia before going after Bartonella, he found a lot more Bartonella treatment failures. Okay, that was an observation. It's not based on any studies done. And I think I had a similar observation in my practice too. Okay, now that's with prescription antibiotics. I don't, but there's also in my practice, knowing of some of the newer herbal ways that we have of treating, I am nowadays, before I stopped practicing, I was starting to go more towards using herbals as upfront. And there is a 3 herbal product program that can hit all 3 of your bees at the same time. And using that triple program, I'll tell you what it is in a minute, I didn't find this issue of singling out Babesia before Bartonella. I found treating them all simultaneously, it worked out well. Okay. And that was to use Cryptolepis, which is got good activity against Borrelia, Bartonella, and Babesia. On the Borrelia and Bartonella front, it's good for persisters. All right. And then the second thing I would couple that with is Japanese knotweed. Japanese knotweed has got activity primarily against Bartonella and Borrelia, and a little bit against Babesia. And on the Bartonella Borrelia front, it's very effective at growing and persisters. All right. And then I liked using a combination product that had liposomal cinnamon, clove, and oregano in it. And those herbs are all good against growing in persister, Bartonella, and Borrelia. And then the clove has some activity against Babesia as well too. So if I were to use the herbal product combination, I would acknowledge it's going after all 3 at the same time, and I tended to have pretty good results with that. But if I were doing prescription antibiotics and somebody had the 3Bs in general, I would try to develop a treatment that would target Borrelia and Bartonella first. And after a few months, as we're getting some of those BART symptoms under control, then I might add in my Babesia treatment at that time.
Wonderful. Thank you so much.
All right. Good luck to you, John.
Bye.
All right. Let's see here. Hello, Sally. Let's see, Dr. Ross. Do you know the status of the 2 antibiotics that work on Lyme, the Hygromycin A and the Piperacillin? So the Hygromycin A, my understanding is it still is being developed. And the idea with Hygromycin A is that it doesn't seem to cause harm to the bacteria in your intestines. All right. The company that is developing it is intending that it would be used for acute Borrelia, not for chronic Borrelia. That's what they're developing it for. I haven't seen the studies yet. I believe they're working through the various things they have to do to get FDA approval. The piperacillin, piperacillin is an existing antibiotic that is out there. It's a penicillin. And I am aware of some recent studies saying that it might be helpful. I think we're going to have to see if clinically if it proves to be or not, basically. So that would be my thought on that. But right now, I believe piperacillin is actually, it's approved, and I think it's available too. Let me double check on that real quick, just a minute here. If I can find my drug directory here. Oh, rats. It looks like it was discontinued. So that makes you wonder if somebody's going to be bringing it back. So on that front, I'm not sure where that hole is in the developmental process. It was, when I completed residency eons ago, it was a penicillin that we could use at that time. So if somebody were to bring it back as a manufacturer, because it already has FDA approval as an antibiotic, they could bring it back to market pretty quickly, though. All right. Sally, did you have any follow-up on that? All right, let's move on here. Hello, Jill. You said hi. Hi back to you. Hello, Missy. Let's see. I'm sure everyone would want to give their condolences to you if your father has passed. Our thanks to your parents for bringing you into this world and gracing us with your caring knowledge. Thank you. Yeah, so many of you know I didn't make last week's webinar because I was in Colorado Springs with my dad's passing. I have been helping Dad manage his life out of assisted living with some hospice support over the last 6 months. And we finally had to move him into the hospital last week, into hospice in the hospital where he did pass away after a 5-day watch. And I have mixed feelings about that. I mean, he's 93 years old and Dad was ready to die. He had lived a full life and he was ready to go. So I'm glad that he did get his wish. It's always a hard thing to watch, as you all know. So I have mixed feelings about it. But thank you for saying that, Missy. I appreciate that. All right, let's see here. Hello, Ed. Let's see. Hi, Marty. Igenix positive for Babesia and anaplasmosis. Taking ivermectin, methylene blue, and a biofilm breaker. Any other suggestions? Surprised there's no Borrelia. So, and it's interesting. If testing doesn't say Borrelia, just be aware it can always still be there. That's the main thing I would want you to be aware, okay? And the only reason I say that, but in general, for instance, if you're on methylene blue, that's picking up Borrelia too. So, sometimes the things we do to pick up these other infections can go after Borrelia as well too. And the only reason I make that comment is if we look at studies of ticks on the East Coast, for instance, we know that about 70% that carry Borrelia carry at least one other co-infection, and about 60% carry two other co-infections. So it's very common that these things run in groups, but not all the time. I mean, it's possible you don't have it. So in terms of so the ivermectin there's one study that I'm aware of that shows that ivermectin can have some anti-Babesia properties, okay? There are no studies that have ever been done in a laboratory or in human beings that say that ivermectin does anything for Bartonella or Borrelia. I have to say that because I think in some ways ivermectin is a fad drug that everyone thinks can kill everything, and it doesn't. Right? As you know, it became popular during the pandemic with some data suggesting it might kill COVID and other data saying it probably didn't. The benefit I think that a lot of people get in Borrelia and Bartonella treatments, and maybe even Babesia, is ivermectin's got some good studies showing that it modulates the inflammation of the immune system. So it's a good cytokine controller. And so even though people are taking it often because they think they're killing germs with it, and again, there's one lab study that says it can kill Babesia. I don't know if it's the strongest Babesia agent, but there's one study that shows that it does. My impression has always been that when people have benefit of ivermectin, a lot of that maybe because it's modulating the immune system, so it's not making as many of those inflammatory cytokines. Okay, and it's those cytokines that give you most of the symptoms that you have in tick-borne infections. Okay, your methylene blue is going to be, and so in terms of anaplasmosis, let me just make a comment there too. So the studies suggest that for anaplasmosis, you're going to want to use either a tetracycline or rifampin. There are no studies that I am aware of that say it does that ivermectin hits anaplasmosis or that methylene blue hits anaplasmosis. So in my practice, if I were treating you at least for a 2 to 4 week period, I would probably add a tetracycline, like a doxycycline or minocycline to this treatment, or consider adding rifampin. Those are the two drugs that have laboratory evidence that they can go after anaplasmosis, okay? The methylene blue has laboratory data, not human data, but laboratory data showing it is effective against Borrelia and Bartonella, both growing and hibernating or persisting forms. Methylene blue eons ago used to be an effective agent against malaria. And so there are some people, because malaria is a blood parasite that acts a lot like Babesia, there's a lot of people that were thinking methylene blue might be effective against Babesia, but most of us have not found it to be effective against Babesia. All right. So in terms of I were to dissect this treatment that you're on, I would think that you might be getting some help from on the Babesia with the ivermectin. But that methylene blue, I'm not aware how it would be helping you for anaplasma or for Babesia. All right. And what you might do if you're is for that anaplasma, I would still look at seeing if you get a tetracycline for at least 2 to 4 weeks. And if you're really trying to do something that might add more effectiveness against Babesia, you might look herbally at the Cryptolepis. And Cryptolepis is really a pretty powerful herb. When I use it for Babesia, I'd like to have people take a pretty hefty dose, a teaspoonful, 5 milliliters, 3 times a day. And that might balance out what you're doing with that ivermectin there too. Okay. And then the other thing with Babesia that we're aware of, and this is also something we're aware of with Bartonella, is Babesia odecoilei, probably not Microti probably not Tacuni, but Babesia odecoilei has the ability to wrap itself up in fibrin. Fibrin is your blood clotting protein. And so it can form what are called fibrin, some people call fibrin nest. And so when I have Babesia, if I'm getting about 2 months into treatment and I'm not making much progress, I might want to add in a fibrin breaker. And that is to use a group of enzymes called lumbric-kinase. Lumbric-kinase is a group of enzymes that are made in the skin of earthworms.
That's what I'm, I'm
Yeah.
taking. My doctor wanted to wait on the anaplasmosis. So I've had it's been going on for a year and a half now, and I'm pretty well, just not getting there.
Yeah.
And strangely enough, last night, for the first time, I think in a year, woke up at 2 a.m. with the sheets soaking wet, just clear out of the blue.
Yeah.
What does that say? Does that say this is not working, or that this might be working, or that I need to do more?
Well, how long have you been on the ivermectin part of this?
2 months.
2 months?
And the reason she prescribed that is because I do not do well with prescription antibiotics. 5 weeks and my gut has problems.
Yeah.
Really reluctant to get back on the Azithromycin. I did a course of that in the Malderone a year, 5 weeks, and then couldn't stay on it.
Yeah. So usually if Babesia is active, it's not going to be a random night of having sweats. It's going to be more pretty regular, like weekly, a few times a week, maybe, every other night, but pretty regular. Random periods of sweating it just happened. It can even happen to healthy people that don't have tick-borne infections, right? So you want to see if there's a pattern. The other thing that can also give some of those night sweats is if you had, like within the last week or so, added a new killing agent and you're having more killing, that would trigger more cytokines, and the cytokines can give you sweating too. Yeah.
Okay. I don't want to take more time. Thank you so much, Dr.
Yeah.
Ross.
Yeah, Ed, if you're really having a hard time tolerating the antibiotics, I'd like Babesia and those kind of Cryptolepis for the Babesia in those situations. Okay. Yeah.
I've closet. I'll add it in.
Yeah. Good luck to you.
Thank you.
All right. Does anyone have any follow-up questions to what Ed and I were just talking about there? Missy.
Yeah, I was wondering if, like, I don't wake up with drenching in sweats, but I regularly wake up hot.
Yeah.
And I do have positive fish, Babesia.
Oh, okay.
But I don't know if, that's if it's from something else. I can't imagine what it would be.
Yeah.
Any ideas?
So, well, first of all, I can't. I am obviously I don't. Your camera's not on, so I can't look at you to answer this part of the question. But if you are of menopausal age and
Way
you're
beyond.
okay, all right, you know where I was going. So
Yeah.
yeah, the hormonal change obviously can lead to some of those sweats. Okay. The other thing that can make you feel hot is if you have any chronic infection in you, because the way the white blood cells, whenever they see an infection, whether it's Borrelia, Bartonella, Babesia, too many yeast in your intestines, your immune system is going to produce cytokines to turn itself on. Okay. And those cytokines can lead to elevations in your body temperature and sweats. So some mild elevation may just be cytokines from having infections, all right? Now, I understand you have a Babesia fish that's positive, and maybe that is contributing. I would also, and that's a good test. A Babesia fish means they saw it under the microscope. It's a direct test, all right? And I would also want to know, do you have anything else that suggests Babesia, though? So, in addition to feeling warm, are you having trouble with air hunger?
No.
Yeah. Are you fatigued a lot? I mean, pretty bad
Yeah.
fatigued. Yeah. So that could be part of it. Headaches in the front of your head. Uh,
Nope.
any issues with that? Any increased deja vu experiences?
Nope.
And then sometimes, and I didn't cover this earlier, but another symptom or sign that people have Babesia is Babesia can give you a bunch of little red spots where you get broken blood vessels under your skin. Now, we all get those as we age, but this would be like having crops of those broken red spots under your skin. That sometimes can happen from Babesia as well, too.
Well, but the temperature, like I'll actually take my temperature
Yeah.
and it doesn't show that it's elevated. It
Yeah.
could be 97,
Yeah.
but I feel hot.
Yeah, it's usually Babesia. I'm not thinking just feeling hot. It's usually the sweats. And what the
Yeah,
sweats
okay.
are you so you're having sweating with this too?
It maybe a little, but I'm not drenched.
Because Babesia triggers an imbalance in your adrenaline, anti-adrenaline system, and you get excessive waves of adrenaline release, which gives you the sweats, can sometimes give you the air hunger, can give you the headache symptoms. And so, and as I said, sometimes it's hard to tease out. Yes, I acknowledge you feel warm and a little sweaty. Is that because of cytokines, because of other tick infections, or is it part of Babesia? Maybe.
Mhm.
But if you've got marked fatigue, you have a positive fish test, I would definitely probably be treating you for Babesia if you were my patient here.
Yeah, I've been doing that, your herbals,
Yeah.
and I did a 10-day of the usual me prone azithromycin. Anyway, well, thanks for your thoughts.
All right. Yeah. Good luck to you, Missy. Did anyone else have any follow-up on that?
I have one.
Yeah, Joe.
Hi.
Hi.
But this might not be a follow-up. It might be, but what it is, it's about, you mentioned the fibrin nests.
Yeah.
And I have symptoms which I've identified as Morgellons. And I wondered if the feelings I have is that itchiness in one very specific place. It
Yeah.
moves around a bit, but it's very one. And could that be because there's a fibrin nest there? It happens to be just the left of my spine.
Oh. So if you have fibrin nest and you have germs that are wrapped up in the fibrin, which could either be Bartonella or Babesia, they're going to not be located. My understanding is they're not necessarily going to be located in one spot. They're going to be throughout your body. right? And so that itching may be a manifestation of Morgellons. It could also be that if you have, Morgellons can be a manifestation of Borrelia infection. There are some people that wonder if it's also a manifestation of Bartonella babesia, and probably it's these infections wear your immune system down and you get skin breakdown as a manifestation of the immune system not being able to control the skin. Okay. We also know that with Morgellons, symptoms will have a lot of itching. They may have fibers coming out of their skin. The fibrin, we think that the fibers are due to your an overproduction of keratin in your skin, and it comes out as these little fibers that come out of your skin, basically. All right, but the treatment usually is go after your germs, right? And I have found in my practice that usually going after the germs and not putting on anyone on anything specific for the skin, just going after the germs would be enough to get the Morgellons under control over time. All right. Itching skin, if it's more localized to a spot and not all over, has me wondering a little bit about nerve injury because one sign of neuropathy is numbness. That's one sign. Sharp stabbing, shooting pains can be another, but itchiness, that's called neurodermatitis, itching from injured nerves can give you that as well too. And so I think you and I may have talked about this before, but you may want to think about doing neurologic support as well too, like being on a glutathione and maybe being on an ATP 360 like we were talking about earlier tonight, phospholipid support, um, uh, which you can find in a product like ATP 360 can help nerve function as well too.
What would have damaged my nerves?
Any one of the three Bs could do it. So Borrelia, Bartonella, Babesia can sometimes lead to nerve injury.
And in one particular place, and the nerves keep firing off, and itchiness there is what.
It can be. I have seen that in my practice before.
Oh.
Yeah. Yeah.
Thanks. I have so many more questions, but I won't take any more time.
All right. Thank you, Joe. Good luck to you. Mhm.
Thank you.
Let's see. Hello, Travis. Let's see. Which infection do you find causes the most debilitating symptoms? Wow. That's a good question. So I can't say that. It's all dependent on the person. So in some ways, Borrelia is the most difficult because it, on average, when it's there chronically, is going to take around 1 to 2 years to get over. Okay. Bartonella and Babesia, in my experience, in 85% of people, while they do give severe symptoms, different types of severe symptoms, in about 85% of people, you can clear Babesia in about 5 months, and you can clear Bartonella in 85% of people within about 4 to 6 months. All right, but with Babesia and with Bartonella, if you happen to be one of those 15% that it becomes a chronic issue, Babesia, especially Babesia odecoilei, we think, can lead to just severe fatigue because of the fibrin nest. It's hard to clear it. And so it can be very debilitating too. And then Bartonella, in about 15% of people, is a very difficult infection to clear. And you often get severe neurologic issues and you get severe mental health issues. And so that could be severe too. So I guess I can't say which one is the most debilitating. It all depends on the person and how it's manifesting in that person. Travis, did you have any follow-up to that?
No, that was really helpful. I have odecoilei. I tested positive for it. So
Yeah.
considering that, would you say that would be probably causing most of my symptoms?
It could be. The physician that's done a lot of work looking at odecoilei is a physician named Harry Lindner. And how Dr. Lindner got into it is, unfortunately, his daughter was just infested with Babesia odecoilei, and she did eventually pass from it. But in his trying to help her, he became very expert in this area. And one thing that he found, and he's taught a lot of us about, is this idea that Babesia odecoilei, because it wraps itself in fibrin, it basically hides against your blood vessel walls, and it's hard to get your agents in there to kill it. He contends, and I just want to say he contends because there's no science that backs it up, but he studied it extensively, that Babesia odecoilei, when you have it, the the best we may be doing with treating is to knock down the germ load, but because of those fibrin nests, we may not be able to completely clear it. And that if when somebody has odecoilei, you can use your antibabesial agents like tafenoquine coupled with Mepron, coupled with azithromycin. That's probably your strongest treatment for it. And then you want to use your lumbar kinase to break down those fibrin nests. But you're going to probably work and get things under better control, and then you could stop for a while, but you may have to come back and retreat again as symptoms come back again. Now, that's his thinking on it. Okay. I want to let you know it's a newer area, and there's just not a lot of science on it, unfortunately. But I think he's got a good argument to make for the difficulty of clearing it, and especially his experience with his daughter who eventually died from it. It speaks to that as well too, unfortunately. Yeah.
Okay, thank you very much.
Yeah. Good luck to you, Travis.
Thanks.
All right. Does anyone have a follow-up question to that? All right.
How do you
Hello.
spell
Kimberly.
how do you spell the Dr. Littner?
Lindner. It's Lindner. Harry Lindner. Actually, let's look it up here together. I'll see if I'm actually going to do a quick. I'm not going to do a screen share, but let me just do a quick search here real quick.
Thank you.
Let's see here. So it's Henry Lindner. So it's Lindner. And I know was practicing out of Pennsylvania. If you were to Google him and put Lyme, you'll find various things videos about him talking about Babesia odecoilei, etc. You'll find all kinds of stuff if you do that. Let me go back here. There you go. All right. All right, let's see here. All right. Hello, Priscilla. Let's see. Hi, Dr. Ross. Condolences and hope you are well. Thanks. I appreciate that. Wonder if you have found out anything more about Powassan virus. I ended up in the ER with cardiac symptoms that could be related. If you have time to discuss, I would be most grateful. Thank you. I've been taking the immune support you recommended. Unfortunately, I don't. I know we've talked about it a number of times here. I don't have anything new to add to what we've talked about before, Priscilla.
Okay, I appreciate that. I'm probably going to contact Yale, and if I find information from them, I will show up here and let you know.
Great, great. Good luck to you.
Thank you very much.
Yep. Hello, John. Let's see. Do you see benefit of taking augmented NAC and liposomal glutathione at the same time? I'm taking both, but wasn't sure if it's redundant. I know the NAC is more the precursors of glutathione, but don't want to waste money. So I personally, well, not personally, in my practice, basically, if somebody was on glutathione, I think that is sufficient and you don't need to be on the NAC. So I think the NAC is extra. So NAC is one of the building blocks for glutathione. And ultimately, what you're trying to do with NAC is build glutathione. So if you're taking glutathione, I don't see the need to be also trying to promote more production of it as well. Okay.
Got it. Thanks.
Yeah.
My practitioner had me on it because I guess I had elevated spike proteins, and she said that taking the augmented NAC was supposed to target that, and then, but she has me on the trifortified glutathione too, so I wasn't sure.
Yeah, yeah, I haven't seen the science on that to know that for sure.
Got it. Thanks.
Yeah. Good luck to you, John. Hello, Shani. Let's see. Hi, Dr. Ross. Thank you so much for help. You're welcome. How would you recommend I get started testing to determine if Lyme or a co-infection could be driving chronic rheumatologic and autoimmune diseases? What labs or steps do you prioritize in complex mixed autoimmune cases like this? For reference, I've been dealing with symptoms for over 10 years, ongoing but manageable chest and joint pain, including sternoclavicular erosion, scalp pustules that flare monthly, and neurologic symptoms like fasciculations, buzzing sensations in my left leg, and hand tremors. I have seen multiple rheumatologists, neurologists, and was labeled with seronegative RA, possible psoriatic arthritis, and Sappho syndrome. Standard treatments like prednisone, sulfasalazine don't help, and biologics were suggested, but I've held off. My scalp cultures were negative, but during flares, I have enlarged lymph nodes. Imaging showed chronic bone changes, and one past Lyme Western blot showed an isolated 41 kDa IgM band, otherwise inconclusive. All right. So, Shani, whenever I'm considering if somebody has tick-borne illnesses, in addition to testing, and I'll come to the testing in a minute, I want to make sure, I want to consider, is there a risk you could have gotten it? Okay, so if you've had tick bites before, yeah, there's a risk you could have gotten it. Even if you don't remember tick bites, if you're a person that does hunting, does a lot of outdoor sports, backpacking, you may be at risk of having come in contact with a tick, and the tick could have bitten you, may have just not known it. In fact, in the springtime, the majority of Lyme is probably spread by nymph ticks. They're baby ticks, and they're the size of a poppy seed. You may not even see it. And so I am always considering, do you live in an area where there's lots of Lyme? Like, are you in the West Coast, or I'm sorry, East Coast, specifically New Jersey, where we know 95% of ticks carry Lyme, right? Or are you a hunter? I mean, I'm considering, I'm looking at all those. Is there risk you could have gotten it, all right? And then I want to also consider testing. And in terms of the best test, and I have an article I'll show you here in a minute, where I say the best test, the best initial test to do for any of the tick-borne infections is the immunoblot method through IGeneX. So the immunoblot through IGeneX is a way to see, do you make antibodies against proteins found in these germs, all right? And what IGeneX does is they have created cultures of germs that produce genetically modified proteins of these various germs. And the reason they're genetically modified is they've tried to remove parts of proteins that would attract antibodies made against virus infections. In other words, they've cleaned up the proteins from these three germs by producing them in a lab so that when antibodies are stuck, your antibodies are stuck on these proteins created in the lab, we know that they must be antibodies really against that germ. Okay, so that's why they do this genetically modified method. And the IGeneX immunoblot, for looking to see if you have antibodies against these various proteins, has the ability to find Lyme, Bartonella, and Babesia, if they're there, of 94%. That's called the sensitivity of it. Okay. The Western blot that you had done before has a ability to find, which is a different technique. It's also a method that we use to see, do you have antibodies are you producing antibodies that will attach to the germ? And the way the Western blot is done is you grow germs and you kill them, and then you take their proteins away, and then you see through this technique whether you have antibodies that attach to those proteins. The Western blot method that has been done only uses one strain of Borrelia, the original East Coast strain from the 70s, versus the immunoblot method for Borrelia that IGeneX does is using proteins, modified proteins from 8 different strains of Borrelia. So it picks up a lot more, basically. Okay. And so that Western blot that you had done that looked at a 41 kDa, that method may only find Lyme when it's present about 70-75% of the time. So it's not the best test that you had done. All right. So to sum this all up, if you're looking to see, is there a test that would show that you have these infections? If you're not on any immunosuppressives like prednisone, because you don't want to knock your ability to make antibodies out when you're trying to test to see, are you making antibodies that attach to these germs, I would look at using the immunoblot method through IGeneX. And so having said that, let me just do a quick screen share here and I'll show you the article. And in the article, I also give you the test ID as well too, okay? Let's see here, let me get out of here. All right, so if we go up here, if you click on guides in the search, so this is a toggle, okay? You can either search for products or you can click on guides and now you can search for my limology guides, all right? And so I'm just gonna type in best test. And is it gonna return? Yeah, there it is. Okay, so this is called the best lab and tests for Borrelia, Bartonella, and Babesia. All right. And if you scale all the way down here, you're going to see this section here. And I tell you what the test numbers are for the immunoblot Borrelia. That's test 325, 335. The Bartonella test is 374 and 384. And the Babesia test is 900 and 905. Okay. And in this article, I make the argument for why the immunoblot is the best way as your first test to figure out these complex illnesses. All right.
Thank you so much. That was very helpful. Really appreciate it. One other quick follow-up to that. Are there any other tests that might help rule out Lyme or identify any other diseases that could be confused for Lyme?
You know, a lot of that. So if you look at some of the literature on complex rheumatologic illnesses, there is some literature that suggests that people with rheumatoid arthritis or other types of arthritis may have what are known as pleomorphic, meaning pleomorphic means it's a germ that has many different appearances or bacteria that have many different appearances. Pleomorphic intracellular bacteria, meaning there is some evidence that there are germs living inside your cells that have different forms. That's what pleomorphic means, that may lead to complex arthritic conditions. We have not identified what these germs are. That's part of the problem. But there is limited science that says, so there, in other words, there's not a test you can do for it. But in complex situations like this, sometimes what I would do based upon what I'm talking about is put a person on an antibiotic for 6 months that would treat for intracellular bacteria, not knowing for sure what the strains are, but because there's lab evidence that says you could have these pleomorphic bacteria. There are some limited studies that show that people that take tetracyclines, which get inside cells, or your macrolides, which would be azithromycin and clarithromycin, may be able to treat these pleomorphic bacteria. And in my practice, I had a limited number of people when I couldn't find out what I could not identify a tick-borne infection that was leading to chronic rheumatologic problems, but but nothing else was working, kind of like you're describing. I would put people on perhaps a combination of a doxycycline and a clarithromycin and try it for 6 months and see if people would get improvement. I had a handful of people that did, not across the board. So it's kind of a shooting in the dark kind of treatment based on a theory that in some people there are these pleomorphic, meaning we don't know what they are, but under a microscope we can see that they have these odd forms and they live inside of your cells, basically. All right.
Okay, thank you. And you recommend the prescriptions in that case as opposed to the herbal for something that's been more chronic?
I would, mainly because there's some lab, I don't have any lab evidence that the herbals are going to work for that, meaning for the pleomorphic bacteria. There are some limited lab studies that suggest I think it's tetracycline, minocyclines, mino or doxycycline would have some benefit against these pleomorphic bacteria-caused arthritic conditions, basically.
Okay, thank you so much. Really appreciate it.
Good luck, Shane.
Thank you.
Does anyone have a follow-up question to what we were talking about there? All right. Anna, let's see. Hi, Dr. Ross. I'm currently treating with a PICC line, 2 antibiotics, and oral tobacone for Babesia. Going to add Tafenoquine. Can that be broken in half as I am very sensitive to medicines? Thoughts on the loading dose and weeks thereafter. So I don't see reason the Tafenoquine could not be broken in half, okay? And, basically if you're sensitive, I never had somebody start at half a dose of Tafenoquine, but the dosing I was using for Tafenoquine, because you can find it's produced depending on what the brand is. I think Quintoffel is 150 milligrams a pill, and the other brand is 100 milligrams a pill. A standard adult dose is going to be more like 200 to 300 milligrams, meaning 2 pills of either the 100 milligram size or 2 pills of the 150 milligram size. And so if I'm trying to dose down, in my practice, I was using just 1 pill instead of 2 pills. I don't see a reason why you could not break it in half and go for a smaller amount if you're very sensitive to medication. So, okay.
Okay, thank you. And then so if I were to cut it in half for that first week of the loading dose, do that twice within the first week, and then perhaps if I respond well, then do it once a week, weekly with the whole pill, or?
Yeah, you could do that. I don't see a reason you couldn't do that. It's interesting when Tafenoquine started being used, when it was brand new and people were just beginning to use it, we did not have a clear idea on the best way to do it. Tafenoquine has an extremely long half-life, meaning it takes a long time to get half of the drug out of you. And because of that, I was actually dosing people every 2 weeks. That's how I was building my treatments. I was dosing, and I had a lot of good improvements just doing it every 2 weeks. I got to admit, across the board, I started having better improvements when I was starting to dose it every week. So I just want to let you know, it's a very long acting drug, basically.
That's what I was concerned of. If I took a whole pill and I reacted, I know that it's going to last a long time in my system.
Yeah. So the thing about half-lives, let's look it up. I never forget the actual number on this, but let me look up the half-life and I'll try to make my point here. So let's see, Tafenoquine. There we go. So Aracoda is the 100 milligram pill. Quintoffel is the 150 milligram pill. Those are the brand names on that. Okay.
I have the Aracoda one.
Okay, so you have the 100 milligram. Okay, let's see, pharmacology. Yeah, the half-life is 16 and a half days. Okay.
Ooh.
Yeah, that's long. All right. So it takes 4 half-lives to get a drug completely out of you. And it takes 4 half-lives of a drug before you develop high levels of the drug. All right. So if you were to take this weekly, it would still take about 1 to 2 months before you develop consistently high levels in your blood, basically. That's what I'm trying to say. So even that low dose, if you were to take it like a half pill weekly, it would still take, even that half pill, for it to get its maximum levels in your blood is still going to take about 1 to 2 months, basically.
1 to 2 months. Okay.
All right.
Thank you.
Yeah. Good luck to you.
Thank you.
Hello, Jill. Let's see. 12 days ago, I started your Lyme protocol again, including the tinctures and the liposomal oregano oil. I had to quit it in February because I had 3 days of not being able to fall asleep at all. I have added glutathione to try to lower the cytokines and charcoal. Do you think I should add L-theanine? Can you tell me the correct order to take these supplements and how much time in between take away from food? I'm taking oregano oil only once per day this time. My blood pressure is low at 87/64. My energy is low. Do you think I should take some mitochondrial supplement? Okay, let me just see here again. So Jill, can you clarify what are the herbal antibiotics you're on? I know you said the liposomal oregano oil. What else are you taking then?
We're taking the Otoba bark and the cat's claw.
Yeah.
That's for the Borrelia, and I'm almost done with those 2 bottles, and then I was gonna go to the ones that treat the 3Bs after that.
You're going to go to the Cryptolepis and the Japanese knotweed then?
Yes.
Okay. So in general, your herbal tinctures are better taken on an empty stomach because you're going to get better absorption. Now, notice I said in general. I have treated plenty of people where the only way they could fit it in was to take it with food and they still got well. Okay. All right.
Okay.
So what I'm expressing is ideally with your herbal tinctures, you're probably going to get better absorption if you take them away from food, but in a pinch, take them with food. And the other thing is if you're starting to get a lot of GI side effects, take them with food. So I'm not hard and fast on having people do the ideal because I have seen improvements even when they take these things with food, basically. Okay. All right. And then in terms of the L-theanine, were you thinking of taking it for sleep? Is that what I'm understanding?
Yes.
Yeah. So the L-theanine, there's a variety of herbs you could use for sleep. L-theanine is one. Theanine is turned into a chemical in your brain called GABA. And if you give more GABA to your GABA receptors in the brain, that can sedate you. Okay. And so I see no problem in adding that in, especially if you had sleep disturbances the last time. Okay. The other thing you could look at, though, would be to take a combination product like Karuna, the manufacturer Karuna, Karuna, has a sleep formula that has in it a variety of herbs that collectively add up to give you sleep. And in a minute, we can go look at what exactly is in there. But that combination, I found good luck using that as well too. And I believe L-theanine is one of the components of that one as well too. But that's another thing to consider as well. But yeah, to be on something that might help with the sleep since that got so disturbed the last time, I think that might be a good idea for you to do too. Okay. And then in terms of if you've had this for years and fatigue is a big part of it, you can assume at this point you probably have mitochondrial dysfunction. It would go hand in hand with this, all right? And so, yeah, I might consider, in addition to the glutathione you've talked about, as you know from what I said earlier, my favorite 2 things to do to rebuild mitochondria, to support mitochondria, would be glutathione and to use a phospholipid mix like that ATP 360, for instance. And again, the ATP 360 has got data showing energy improvements and better thinking being on it as well too. So I do think that might be a good idea for you. Okay.
Okay. I was just kind of getting confused with like, am I supposed to take like the charcoal after the glutathione? Like it just seemed like I had to take everything away from everything else.
Yeah.
And it was
I,
hard to know when to take different things.
so I'll be honest with you. I know that some people use charcoal because they think that that the reason they feel bad is because it's the release of toxins and they're trying to bind them up in the intestines, all right? I don't fully agree with that. I think that the majority reason that people feel toxic and they feel worse is when you start killing germs, you trigger more cytokines. And so I focus more on the things that lower cytokines, like glutathione and like being on a source of curcumin. Those are the things I emphasize. And I have not really found benefit from the charcoals. And I will admit, having charcoal in here complicates because you don't want to take it with a bunch of other things that bind and it will bind them up. So you might look at removing the charcoal. And if you're not doing a curcumin here, like the thorn curcumin phytosome is a form of curcumin, then you might consider adding that in place of that charcoal, for instance.
Hmm. Okay, thank you. And I was just going to do 1 capsule of the oregano oil because I felt like that was when I stopped
Yeah.
sleeping when I was doing 2.
It's okay to start with one. I mean, find a dose that seems to you can tolerate and eventually moves you forward. And if that's one, start with one. There's no problem in doing that.
Okay, thank you so much.
All right. You're welcome. Let me just do a screen share here. So the let's see here, share. All right. So back here at my store, so the sleep, in terms of things that I carry that for sleep, you could use my mega menu here, and you can look under the sleep, the ones that are on my sleep aisle, okay? And on the sleep aisle, this is the sleep formula. This tends to be more my go-to. This is what I tend to use quite a bit of. And this has got in it valerian, lemon balm. It's got hops in it and passion flower. I kind of like this combination. Okay. Um, if you want to try the L-theanine, that's fine too. Sometimes it's a trial and error to find what's going to work. I tend to find combinations products tend to work better than not having a combination product. Okay. All right. And another combination product I think I'm finding some good benefit is this Research Nutritionals Circadian PM. And this one has got in it, it's got glycine, it's got valerian, it's got some curcumin in it. And the reason that is interesting is increased cytokines make it so you can't sleep. Okay. So it's going to be controlling it. It's got some 5-HTP, it's got L-theanine, it's got pharma-GABA in it. And yeah, this is a comprehensive one that you might want to consider as well too. Okay. All right. All right. Good luck to you, Jill.
Dr. Marty, I had a follow-up, if that's all
Yeah.
right.
Yeah.
You had just mentioned about steering away from activated charcoal, and I have in my question about activated charcoal that I just added it.
Yeah.
And that is because I'm clearing out mold and candida.
So if you have mold toxins in you and you have toxins that activated charcoal work against, then I think it's a good idea to be on activated charcoal. But in terms of some people just use it because they think because they feel bad without having evidence of mold toxicity, they go on activated charcoal. I don't see the benefit in doing that. But in your situation, if you have one of the toxins in you that activated charcoal is known to remove, then yeah, be on that.
And as far as taking it away, I'm just doing it right before bed.
Yeah. So generally what I like to, because you have to worry about it binding good things, I mean, the things you're taking, right, is general rule of thumb with any binders that I like to do is make sure you stop taking all medicines and medicines at least, and that means supplements too, at least 30 minutes before you take them, and don't take anything for at least 2 hours after you take the binder. So yeah, take it at bedtime. You should be fine with that because you're not going to take anything else while you're sleeping in the middle of the night then. Yeah.
Awesome. Thank you.
You're welcome. Good luck to you.
Thanks.
All right, let's see here. Hello, Joe. Let's see. Is there a limit to the amount of time one can take your herbal medications for? And then should you have to rotate something else? For example, cat's claw and cryptolepis. And how much cat's claw is it? 30 drops 3 times a day? Or is it 5 milliliters, as I've heard somewhere? So for cryptolepis, I like dosing that. Depends on what I'm treating with it. Okay, so if I'm treating Babesia for cryptolepis, I like to dose at 5 milliliters 3 times a day. If I'm using cryptolepis for or not for Babesia, but I'm using it for Bartonella or Borrelia, I like dosing it at 2.5 milliliters or half a teaspoon 3 times a day. So on that, okay. Cat's claw, I have always found good results doing 30 drops 2 times a day. I know there are some that advocate 3 times a day. You could do that. I usually found just the same kind of results, whether it was 2 times a day or 3 times a day. Okay. I think Buhner may have recommended 3 times a day. I can't remember now for sure, but I know Buhner talked about using cat's claw in his protocols. And then how long can you use these? I would use any herbal antibiotics you're on. In my practice, I would have people, as long as they were seeing improvements, I would have them stay on them for up to about a year. And then at that time, I might consider rotating. Prescription antibiotics, on the other hand, I would find would start losing their effectiveness at about 6 months. And so in my practice, I'd like to rotate out prescription antibiotics more frequently than I would herbal antibiotics. Okay. Joe, did that answer your question for
Yes,
you?
that really answered all of them. Thank you so much.
You're welcome. Good luck to you.
Thank you.
All right, let's see here. Hi, Dr. Marty. On Monday, my friend saw that what looked like a tick crawling in my hair. She pulled it off. I glanced at it and it fell, never to be found. Excuse me. The next day, I felt a scab on my scalp and this bump on my scalp. No rash. Excuse me a minute here. It would help if I swallow correctly there. Let's see. The next day, I felt a scab on my scalp and this bump on my scalp. No rash. Pick taken today. I feel fine right now. We live in Lyme country in Western North Carolina mountains where Lyme is very prevalent. I pulled ticks off my dog and my daughter, and I always send them out for testing. They have all been negative, but I know so many people with Lyme. My question is, should I take an antibiotic since I cannot test the tick? I cannot take doxy, so will amoxi be effective? And if so, how much and for how long? Or should I wait and get immunoblot first and then I've been on low dose naltrexone for 2 years to manage my Hashimoto's and have been gluten free and what is DF? Is that disease free?
Dairy.
Oh, dairy free. I was gonna say. All right, so this is a hard question. If you had a known tick bite in Lyme country, and known meaning you saw it attached, you knew that it was what gave you that mark, then I usually do advocate doing at least, and you don't have any symptoms. So if you have no symptoms and you have a tick that was attached and you are in an area where there can be a lot of illness, you want to do a minimum of 3 weeks of an antibiotic, okay? The issue here is you've got no symptoms and you have something that looks like a bug bite, but I don't know, and that's not a bullseye though, so I don't know whether this is a manifestation of a tick bite or not, okay?
Nor
But
do I.
yeah, I know. So so that's the $1,000,000 question here. If you are concerned though, because you saw that tick and you wanted to be safe, you could do. So the distinction here is if you are asymptomatic, 3 to 4 weeks is what we recommend. If you are symptomatic, which means either a bullseye rash, temperature, body ache, something that looks like acute Lyme, you want to go 7 to 8 weeks of an antibiotic protocol.
Either
Okay.
amoxicillin as well, like either or.
I'm going to come to that here in a minute.
Okay.
All
Okay.
right. Now, if you cannot tolerate a doxycycline, what I would do is either a clarithromycin or an azithromycin.
Oh.
Yeah, because they are intracellular antibiotics, just like doxycycline is. And that means they're effective against getting inside a spirochete, all right? But also if the spirochetes have invaded your cells, they can get inside the cells to get the intracellular form as well, all right? Your amoxicillin, although I know that the Infectious Disease Society of America and others recommend the amoxicillin, the trouble with that is it's only useful against spirochetes living outside your cells. It doesn't do anything about the germs that have moved inside your cells. So I usually like to cover for both, okay? In addition, if you happen to have that tick happen to have Bartonella or Babesia, although I would never use a tetracycline by itself in chronic Babesia or Bartonella, or a macrolide like clarithromycin or azithromycin by itself as the only thing to treat a chronic Bartonella or a chronic Babesia. In an acute situation, they may nail it. And so you've got some potential coverage, killing ability if you have if this was a tick that gave you that mark, it bit you, it transmitted, you would have some safety against those Bartonella and Babesia as well, potentially too. All right. Now, so on the one hand, if you want to be 100% safe, take an antibiotic, okay? On the other hand, any antibiotics you take are going to disturb your gut microbiome. And more, we are very aware of, when you've got known infections, the risk of not treating the known infections versus the risk of harming the microbiome, lean towards you got to get your germs under control, okay? But in a situation where you don't have symptoms, you don't have anything, you're not for sure, you have to just be aware that there is this issue of the gut microbiome being harmed. And so definitely, if you're going to do it,
I take a lot of probiotics to begin with.
Pour in probiotics in. Yeah. Okay. All right. So those, and I can't tell you what's right for you. I just want things you consider, basically. Okay.
But amox with azithromycin would be a better combination.
I wouldn't even do.
Don't even do the amox, just the azithromycin.
Don't even do the amox. If you can get azithromycin or
for 3 weeks,
clarithromycin for 3 weeks, that's what I would do as a preventive.
Okay.
Now, if you start getting symptomatic, that flips you to being on antibiotics for 7 to 8 weeks.
I gotcha. Okay. Okay.
All right.
Very good to know. Thank you so much.
Good luck to you.
Thank you.
All right, everyone, that's it. It's been fun being with you here again tonight. I got to tell you, this was more interesting than sitting beside watching my father last week. So I'm glad to be here with you all tonight and to be helping out. And again, as I said about Dad, I'm actually, for his sake, I'm glad he passed. He was ready to. So, but it's still something to be going through for me for sure. So listen, everyone, I will get the video out tomorrow morning. You'll get email notification of it being out. If you happen to miss that email, as I showed you earlier, you can go to the webinars page and it's posted right there. You'll be able to see it there once I get it up, okay? And then we will be doing another webinar next week. So tomorrow morning, I will provide the link for where to sign up. But if you happen to miss it on the webinars page, there will be the link to sign up for next week as well, too. Okay? All right.
Hey, Dr. Ross.
Yeah, John.
Excuse me. Can you clarify how it is best to submit questions for the upcoming call each week?
Yeah, so you don't submit them in advance. I just take them right here when people write them in the chat box.
Okay, so you just don't take all the questions. That's all you pick.
There's no way I can get through all of them, unfortunately.
Got it. Okay. Thank you.
Very good. All right, everyone. Good night.
Thank you. You're so
welcome.
great.
Bye-bye.